Hi, so this is my neuro assessment. Prior to proceeding with the video, I'd like to ask you for permission to record and upload this as unlisted for my professor to view and grade. Do I have your consent?
Yes.
Perfect. So my name is Vernika, and I will be your student nurse practitioner today. I've gone ahead and washed my hands, put on gloves. We're going to start off by assessing the patient's orientation. So can I have your full name and date of birth?
Annette Ramos, 11/20/93.
Perfect. And do you know, could you tell me the date and year of today?
February 13th, 2023.
Awesome. And can you tell me where you are right now?
I'm at the clinic for a wellness exam.
Perfect. So the patient is alert and oriented ×3 to place, time, and event. The speech is clear and appropriate. It's not pressured. It's even. So that's perfect. We're going to assess for memory next, both recent and remote. So Annette, could you tell me who the first president of the United States was?
George Washington.
So that was assessing her remote. And then for recent, what did you eat for breakfast today?
Had egg bites.
Perfect. Next, we're going to assess for reasoning and judgment. So Annette, what similarities do oranges and apples have?
They're both fruit.
Perfect. And then if you found a sealed envelope on the floor with the stamp and address, what would you do?
Put it in the mailbox.
Perfect, put it in the mailbox. So we're going to move on and test the cranial nerves. We're going to start off by cranial nerve number 1, which is olfactory. This is to identify odors. So Annette, I'm going to have you close both your eyes. First, we're going to check for patency in the nostrils. So Annette, if you could push against one nostril and take a deep breath in. Perfect. And then change nair. So go ahead and press the next one. Awesome. Keeping your eyes closed, so we're going to assess for her smell. Go ahead and occlude one nostril for me. Perfect. And if you could go ahead and tell me what the smell is.
Coffee.
Perfect. So she identified that correctly. And now if you could go ahead and cover your other nostril and tell me what the smell is.
Alcohol.
Perfect. The second was the alcohol wipe. So cranial nerve number 1 is intact. Next, we're going to go to cranial nerve number 2, which is the optic nerve. You can go ahead and open your eyes and that. So for the optic nerve, we're going to use the Snellen chart to assess her eyes. So I have a pocket Snellen chart. Usually you would stand 6 feet apart, but for the purpose of this video, I'm just going to be doing it right from here. And now if you can turn this way, if you could block your left eye. Perfect. And if you could read the smallest line for me.
LTFPH.
Perfect. And now if you could switch and cover your other eye and read for me.
LTFPH.
Perfect. And now open both eyes and read the lowest line for me.
LTFPH.
Perfect. So she has, according to the chart, 20/20 vision, which is great. Next, I'm going to assess for peripheral vision. So for this one, I'm going to put my fingers behind her and I'm going to put my fingers behind her and have her let me know when she can see them. So, Annette, let me know when you see my fingers.
Now.
Perfect. And then this way.
Now.
Perfect. So peripheral vision is intact and equal bilaterally. Next, I'm going to use my ophthalmoscope and we're going to have a look into her eye. So we're going to get this. And we're going to turn the light on. Perfect. And then we're going to go left eye to left eye. So we're going to have a look. I'm going to put my hand here for protection. And we're going to look into her eye. Awesome. Then we're going to do the other one. So we're going to use this eye. Perfect. So when I was doing that, I was looking for the red reflex, which I saw. And I'm noting the retina, the blood vessels, the disc and cup of the eye. We looked at the cup to disc ratio, which was 1:3. Then we're going to move on to cranial nerve number 3. We're actually going to do 3, 4, and 6 together. So we're going to be testing those 3. And now I'm going to have you cover one eye for me. Perfect. And then I'm going to have you follow my finger. So we're going to be testing for cranial nerve number 3, which is oculomotor. Perfect. And then next we're going to be testing for cranial nerve number 6, which is abducens. And cranial nerve number 4, which is trochlear. Go ahead and swap hands for me. We're going to do the same thing on the other side. Perfect. So we're going to do, follow my finger in that. We're going to do 3, oculomotor, 6, abducens, and 4, which is trochlear. And while I'm doing that, I'm also looking to see if there's any signs of nystagmus, which is the rapid movement of the eye, which we did not see today. Next, we're going to check the pupillary reflex. So I'm going to use my pen light for this portion, and we're going to see the eyes, the pupils constrict. So we're going to go one at a time. We're going to flash the light onto the pupil and see it constrict. And now you're going to see a little light in your eye. Go ahead and just look over my shoulder. Awesome. Perfect. So the pupils do constrict from about a 5 to a 3, which is normal. Next, we're going to test the consensual one. So I'm going to put the light over an eye and look at the other one to see its reaction. So now go ahead and look over my shoulder again. I'm going to flash the light onto this one and look into the other eye. Perfect. And flash the light onto this one. Awesome. So pupils are reactive to light, and also when I do the consensual one, the opposite pupil also constricted, which is what we're looking for. So next we're going to move on to cranial nerve number 5, which is the trigeminal. So we're going to be testing the sensation on the forehead, cheek, and jaw. So we're going to do a sharp and dull item. Annette, I'll have you close your eyes and tell me if you feel a sharp or a dull sensation, okay? So we're going to use my little cotton swab with the...
Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Sharp.
Perfect. So we tested all the areas and she got them correct. I'm now going to test for jaw resistance. So I'm going to put my hand here. If you can try opening your jaw for me, Annette. Perfect. So motor cranial nerve number 5 is intact. And then we're going to move to cranial nerve number 7, which is the facial. So for this one, Annette, I'm going to have you raise your eyebrows and wrinkle them. Perfect. And then go ahead and big smile for me. Awesome. So facial nerve is intact. We're going to move to cranial nerve number 8 next, which is the acoustic one. It tests the vestibular ocular nerve. So I'm going to stand behind Annette. I'm going to have her cover that ear, and I'm going to whisper something and see if she can tell me what it is.
Apple.
Perfect. So she did it right. So we're going to do the other side now. Go ahead and cover that ear for me, Annette, and I'm going to go behind.
Baseball.
She said baseball. Perfect. We're also going to check for the Webers. I'm going to use my tuning fork for this. I'm going to go ahead and hit it and put it on the top of her head and ask her if she feels the vibrations on one side or both ears. So Annette, let me know if you can feel it on both sides or one side.
Both.
Perfect, and that's what we want to see. Next, we're going to check the Rhine test, which I'm going to use the tuning fork again. We're going to put it onto the mastoid bone first, and when she can no longer hear the noise, we're going to move it to her ear. This is testing for bone conduction versus air conduction, and air conduction is always longer than bone. So Annette, let me know when you can't hear it anymore.
No.
Perfect.
No.
Awesome. We're going to do the other side as well. On the mastoid. Let me know when you don't hear it anymore.
No. No.
Perfect. So in this case, air conduction is longer than bone conduction, which is what we wanted. So that is all for cranial nerve number 8, which is intact. Next, we're going to move to cranial nerve number 9 and 10, which is glossopharyngeal and the vagus. So Annette, I'm going to have you open your mouth and say ah.
Ah.
One more time, ah.
Ah.
Perfect. So what I was looking for there is that her uvula is intact and arises while she says no. She says ah, which it did. And then I'm also going to see if she can swallow. So Annette, go ahead and swallow for me. Perfect. And that one assesses cranial nerve number 10, which is intact. She was able to swallow, and her speech is not coarse either. So perfect. We're going to move on to cranial nerve number 11, which is the spinal accessory. So I'm going to have the patient shrug her shoulders against my resistance. Go ahead, shrug for me, Annette. Perfect. The patient was able to do so, which is perfect. And the next we're going to test for sternocleidomastoid muscle. So I'm going to put my hand on the patient's cheek, and then I'm going to have you push against. Perfect. And then this side. Perfect. So cranial nerve number 11 is intact. Last one, cranial nerve number 10 is hypoglossal. So Annette, can you go ahead and stick your tongue out for me? So I'm making sure that the tongue is midline and it's not deviated at any point. We're also going to go ahead and check the strength of it. So Annette, I'm gonna push my tongue blade against your tongue, if you can just push with resistance. So go ahead and push that to the left, and then this way. Perfect, and that's just assessing strength, which is intact here with Annette. So next we're gonna move on to assessing the cerebellum. So we're gonna start off with the general gait. So Annette, if I can have you get up for me, stand right here, and just walk across the room for me. Perfect. Next we're gonna do the tandem walk. So if you could walk with one foot in front of the other for me. And we're checking for balance while she's doing all of this. Awesome, Annette. Now if you could walk back on your heels. And lastly, if you can walk back on your toes. Perfect. Go ahead and stay standing for me. We're gonna next test the Romberg and the pronator drift. So for the Romberg, and if I could have you put your feet together, close your eyes, and also put your hand out, palms facing forward, and go ahead and close your eyes. So we're gonna have her do this for 30 seconds. If there's any swaying or anything like that, that would be testing the Romberg. For her arms, if they were to flip over, that's testing the pronator drift. So after 30 seconds, we're also just gonna push down her arms and see if they come back, which is what we're looking for. So those are both negative, which is great. You can go ahead and open your eyes for me. You can go ahead and have a seat. So next we're going to do the rapid alternating movements. So I'm gonna ask the patient to touch my finger and then their nose and kind of like alternate like this. So Annette, go ahead and touch my finger, your nose, my finger over here, your lap, perfect, your nose again, and this finger, perfect. So she was able to follow my commands. Next, we're gonna move on to the sensory system. So we're gonna start off with the joint position exam. So Annette, if you could go ahead and close your eyes again for me, go ahead and I'm gonna hold your hand and let me know if I'm moving your digits up or down, okay?
Up, down, up.
Perfect, we'll do the other hand as well.
Up, up, down.
Perfect. Next, we're gonna check for 2-point discrimination. So this is kind of another part of the sensory exam. I'm gonna grab a paper clip, which I've opened, and then we're gonna ask the patient if she can feel 1 or 2 points. I'm gonna have her eyes closed. I will also do this bilaterally on both arms for her. So I'm gonna get your arm forward. I'm gonna roll your, perfect. Go ahead and close your eyes for me. And then,
2, 2, 1, 2.
all right, we'll do the other arm.
1, 2, 1, 2, 2.
Perfect. And then we're gonna go on to testing graphesthesia. So this one, Annette, please keep your eyes closed still. Go ahead and hand me your one of your hands. And then I'm going to draw something, and if you could tell me what you feel.
8.
Perfect. And your other hand.
H.
Perfect. So she got those right. You can go ahead and open your eyes. Next, we're going to test the upper extremities and lower extremities for sensation. So we're going to use a cotton ball, which is a soft sensation, and then we're going to use this little stick, which is kind of like a pinprick sensation. I'm going to have Annette close her eyes and then let me know if she feels something soft or sharp. We're going to do this for both the lower and upper extremities. So Annette, keep your eyes closed and let me know if you feel soft or sharp.
Sharp, sharp, soft, 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 sharp,
Perfect.
sharp, 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 sharp,
Sharp. It's harder. She has pants on for her to feel the soft. This part pull it up a little bit so it's a little easier.
soft, sharp, soft, sharp,
Pull this one up a little bit too.
sharp, soft, sharp,
Perfect. So she was able to differentiate between the sharp and the soft. Next, we're going to move on to the vibration sense. So we're going to use our tuning fork again, and we want to see if she can feel the vibrations in the areas that I put it. So we're going to hit it, and then we'll start off with the wrists. Do you feel the vibrations?
yes,
The other one.
yes,
And then we're going to go to her elbow.
yes, yes,
Awesome. Next, we're going to move on to her knees. So let's see. Let me know if you can feel the vibrations in it.
yes, yes,
And lastly, we're going to check on the top of her foot. So I'll have you put up right here. Perfect.
yes,
And we'll grab the other one.
yes,
Perfect. So she's able to feel the vibration sense, which is what we want. Next, we're going to move to the motor system. So we're going to check for her deltoids, triceps, and biceps. So Annette, go ahead if you can put your arms out like this for me. Perfect. So then I'm going to stabilize and push, and go ahead and push against me. Perfect. Same thing on here. Awesome. And then go ahead and push down while I push up. Perfect. Go ahead and move your arms like this for me. So now we're going to go ahead and push against my hands. Or, sorry, no, it's okay. Push against my arms. Perfect. Push this way against my arms. Awesome. So that was checking her strength in those areas which are intact. We're going to check her finger strength. So go ahead and stick your fingers out for me. And then go ahead and spread them as much as you can. Go ahead and try to close them, or keep them open, sorry. Perfect. And then put them together and go ahead and try to open them. Awesome. Same thing on this side. Go ahead and open them for me and try to keep them open as I try to close them. Perfect. And then close them for me and try to open them apart. Perfect. So we checked the fingers. Next, we're going to check the hand grip. So go ahead and if you want to go ahead and grab my fingers as hard as you can. Awesome. And then keep your hands closed and try to open them against my resistance. Perfect. Next, I'm going to have the patient lay down so we can assess the lower extremities. So Annette, if you want to just have us lay down. We're going to check the quads, the hamstrings, the hip abductors, and the adductors. So go ahead and first we're going to have her keep her legs straight for me. All the way straight first. And then go ahead and push up against my hands. Perfect. And then I'm going to have bend up like this. And then go ahead and push against again. Awesome. We'll switch to this leg and go ahead and push. Perfect. And then put your legs straight for me and separate them a little bit. And then go ahead and try to push in and push out. Awesome. So that was checking her hips. The strength was even on both sides, and they were at a grade +5, which is what we want. And next, we're going to go ahead and check her reflexes. So I know you can come on and sit back down on our stool here. So I'm going to use my little tool, and we're going to test her deep tendon reflexes. So I'm going to start off with the biceps. So I'll pull this up and get nice and relaxed in my hand. Nice and relaxed. And one. Perfect. And then we're going to do the triceps. So we'll have her move her hand like this, nice and relaxed. I'm going to hit her right here. Perfect. And then we're going to do the same thing on the other side. So go ahead, nice and relaxed. Nice and relaxed. Perfect. And then bend over. We're going to do the triceps, nice and relaxed. Awesome. Next, we're going to move to the knees. So that one, I'm going to get down here. I'm going to pull your hands a little up and then nice and relaxed. Perfect. Nice and relaxed. Awesome. Next, we're going to check the Achilles, which is behind the foot. So nice and relaxed. Perfect. We got this one nice and relaxed. Awesome. Lastly, we're going to check for the Babinski reflex. So we would have to take her socks off for that. I'm sorry, Nick, can I take your socks off? Awesome. So we'll do this one. We're going to use the back of this to caress the foot. And then the toes should plantar, which is what we're looking for. If they were to spread open, that's something we see common in babies and would be a positive Babinski reflex, which is what we do not want to see. So that concludes my neuro exam. Annette, do you have any questions for me?
No, thank you.
Perfect, thank you.